What I'd like to do is just summarize what we aimed to go after and what we have actually made progress on this year, to remind everybody that our mission is to improve health by empowering a community to collaboratively generate the evidence that promotes better health decisions and better care. And we've been doing that through various collaborations in data standards, open source development, methods research, and clinical evidence generation. We've also put a lot of effort towards developing our OHDSI evidence network and enabling the conduct of OHDSI network studies. Our community, as it stood at the Global Symposium, now reaches 4,294 collaborators around the world. And so welcome all of you who have joined and to be part of that. 4,294 people is a lot of people, which should mean that we can make a lot of progress in any given year if we are actually all truly collaborating towards a shared mission. Now, some of the stuff that I'm going to be talking about is highlighted in our OHDSI annual report. Craig does a wonderful job of producing our journey book, though I'm going to actually take a chronological view of what we've achieved this year, just to try to reflect on the year from January to now in December. So at the start of the year, we had a kickoff meeting where we asked ourselves the question, where should we go together? And in that meeting, I introduced, inspired by Jim Collins' book, Good to Great, this idea of trying to identify the areas that could make us great by having us focus on kind of three fundamental questions. What are we deeply passionate about? What can we be the best in the world at? And what drives our economic engine? And the argument that Jim Collins makes in this book is that organizations that are truly successful figure out that sweet spot right in between those things. And so I raised to us as a community about where we really would be in that space. And to motivate that, we highlighted that all the way back in 2018, we'd expressed the idea that evidence at scale was something that uniquely differentiates us as an OHDSI community. And one of the big areas that we could focus on is evidence dissemination, to make sure that the evidence that we generate gets out in the hands of decision makers. And highlighted that this has been a theme for a while that Martijn had presented even in the 2022 symposium, showing the work of objective diagnostics is taking us a step further from the traditional paradigm of a given researcher in a bespoke ad hoc way, defining a question, generating evidence, interpreting the results, and ultimately disseminating them, and to think about how we can take a more systematic approach to this process, whereby we now have standardized ways to define questions, standardized tools to generate evidence, a standardized rubric for interpreting study reliability through objective diagnostics, and we hoped to identify best practices that would standardize our approach to interpreting study results so that we could provide them in a more consistent manner. Now, at this kickoff meeting, I specifically asked you all what were our areas of this hedgehog concept of topics that we were passionate about, what could we be the best of the world at, and what would drive our economic engine. I think it's useful at this point at the end of the year to look back at what your poll everywhere responses were. So when we asked the question, what are you all deeply passionate about? A large number of you highlighted and reinforced that reliable evidence was one thing that you were deeply passionate about. Many of you highlighted impact on patient care. And some of you also highlighted simplifying the process for making data available. And so I want you to keep in the back of your mind these three areas that we're deeply passionate about as we kind of assess for ourselves how well we've done this year. Now, the second question that we asked was, what can we be the best of the world at? And many of you had upvoted large-scale evidence as being something that we could be the best of the world at. Many of you highlighted running global network studies, again, generating reliable evidence at scale, and also developing and validating methods in the use of real-world data to generate evidence. And so if we combine together the things that we're passionate about alongside the things that we believe the best of the world at, these should be things that would uniquely differentiate our OHDSI community as areas that we should be spending our time and focusing and delivering on together. The last question that we asked at the start of the year was what drives our economic engine? So, what is kind of a measure of our return on investment? And many of you highlighted that, particularly those in academia are often motivated by opportunities to receive grants. And as well as academic publications. And it was also highlighted just the fact that as an open science community, we're dealing with a lot of free labor. And the question really becomes, how do we actually take the tremendous volunteer resources that are brought to our community and take advantage of them? Now, I highlight these reflections on where we started the year just as a backdrop to now walking through what did we actually accomplish. In January of this year, we had our version 1.9 release of Hades, as well as releases of our OHDSI Shiny modules, Phenotype Library, Phi Evaluator, and Strategus. And I think one of the prevailing themes that you'll see is the tremendous progress we've made as an open source development community and the rapid progress that we've had various tools that we've been developed. And indeed, towards that question of we asked what are we can be the best of the world at, one of those was developing tools. And already at the start of the year, we saw tremendous progress towards developing a suite of analytics, open source analytics that all of us could benefit from. In January, we also saw a large collection of publications, again, going towards that economic engine of academic publications being something that we can measure ourselves by. We saw a wide range of publications. Just in the interest of time, I'm only going to be able to highlight one a month, but I'll highlight this paper on the OHDSI standardized vocabularies that was published in JAMIA. Christian was the first author, and it really highlights some of the basic principles that underlie our vocabularies. And since the vocabularies have been a key area of emphasis for us to try to make sure that this global communal resource continues to develop and expand, having this landmark publication to kind of represent that work was an important accomplishment. In February, we had each of our work groups present their objectives and key results. And I think one testament to the growth of our community is the diversity of different activities that are going on across our communities and the efforts that we are trying to make to bring the community aligned towards having some objectives that ultimately connect to our global mission that we have. And so one of the things that I'll encourage all of our work group leaders to do is reflect on their own annual OKRs about how much progress that they've made. And potentially as you're entering in information into that poll everywhere, you can highlight the successful accomplishments of OKRs that you set forth at the start of the year. Now, February was also our now annual tradition of conducting Phenotype February. This year, we focused on 4 different clinical phenotypes, and we specifically tried to evaluate the current state of literature in terms of how much heterogeneity is actually observed in the current literature, whether or not those phenotypes were something that could be reproducible, and to the extent to which the variation that was observed in those definitions reflected something that would actually have a meaningful impact on the results of observational studies. This work had a lot of collaboration throughout the month, which was really great to see people coming together. And it was really wonderful to have Aza Shwaibi be able to highlight this work in an AMIA presentation towards the end of the year to show our community taking on a problem, delivering it, and ultimately producing evidence. I think the stark finding here, though, was that the current state of play in observational research has tremendous heterogeneity, that the impact of our phenotype definitions is extremely important, whether you're trying to characterize the incidence of a disease or study and estimate the incidence of an outcome, that phenotypes are really pivotal to that, and yet the current state of play in the broader research community suggests that we need to make substantial progress towards increasing the consistency and reliability of our phenotypes. And I hope that this is an area that we'll continue to work on together as a community. Now, February also saw one of our 2 biannual OHDSI vocabularies, standardized vocabularies releases. The broader vocabulary team did a wonderful job of sticking to our agreed roadmap in delivering a February release that had refreshed many vocabularies as well as improved areas that we had prioritized based on our vocabulary landscape assessment. And so big thanks to our broader vocabulary team for this successful release, one of two during 2024. We saw continued progress on our open source development. The Hades packages were released with version 1.11, but we also saw releases of the OHDSI Shiny modules, feature extraction, and data quality dashboard in February. Contributions from our open source developer maintainers. February also saw a wide range of publications. One I'd like to highlight was a paper in the Journal of Imaging Informatics and Medicine entitled Development of Medical Imaging Data Standardization for Imaging-Based Observational Research, the OMOP Common Data Model Extension. This was work that came out of our imaging work group led by Chan and Paul, and it really highlighted how the OMOP Common Data Model can expand to additional data modalities, and yet how we've got a congruent approach that can bring in this additional information and facilitate research, which I think is a demonstration that we've now seen play out successfully multiple times in 2024. In March, we saw additional releases of the characterization package and SQL render. We also saw a wide collection of different papers. The one I'd like to highlight is the paper by Cindy Kai that was published in similar risk of kidney failure among patients with blinding diseases, an OHDSI network study. This was in fact the publication that came out of the SOS challenge from 2023. So it's pretty remarkable to see an idea that Cindy brought to our community through her work as well as the hard work of our broader community materializing into a paper in press less than 1 year after initiating that SOS challenge and bringing together a large collection of collaborators across our community alongside multiple databases across our OHDSI network. In April, we saw our first of our April Olympians events, led by Claire and Melanie. We saw a great effort that was put towards trying to strengthen our data and data quality conventions and our Themis conventions. We had a good community collaboration towards trying to identify areas where we could improve our documentation, identify new rules, and create constructs and tests around those rules. And what I think is probably most helpful here was just raising awareness about how we're trying to improve our our open community data standards, not just from the perspective of having a data model, but also from the perspective of how do we actually get community alignment about how to use that data model appropriately across the diverse sets of data sources that are available within our global community. We saw multiple open source tools released in April that included another version of Hades, as well as updates to characterization, CirCR, Eunomia, feature extraction, OHDSI Shiny modules, and the patient level prediction package. Of note, particularly here, CirCR and Eunomia making it into CRAN, expanding their availability to the broader research community beyond those who are readily accessing OHDSI's tools through our GitHub repository. In April, we saw a large collection of papers that were also published. The one I'd like to highlight was one that was published in Lancet Respiratory Medicine entitled The Effectiveness of COVID-19 Vaccines to Prevent Long COVID Data from Norway. I think this paper was a really beautiful illustration of the power of an international network. There was an initial paper that was published with results from the UK and Spain, but because of the use of the OMOP Common Data Model and a standardized analysis package, colleagues in Norway were able to take that study that was previously published, execute the analysis on their own data, and compare the results to expand the generalizability of the findings of the original study, which I think is a nice demonstration of how an international community can work together to continue to expand and improve the reliability of evidence that's available. Come May, we had another release of our Hades packages, as well as updated versions of Caper, Cohort Generator, Cohort Method, Results Model Manager, Self-Controlled Case Series, and SQL Render. It was really impressive to see how much continued progress we were making on the open source data front. One reflection that I have to highlight here is that we saw a lot of these kind of core packages that are kind of instrumental to orchestration of studies, really making tremendous progress to make these much more available, accessible, and hardened for the broader community's use. In May, we saw a large collection of papers come out. One that I'd like to highlight is from our colleagues at Taipei Medical University, publishing a paper in BMJ Health and Care Informatics, highlighting the TMU clinical research database and their work towards standardizing this to the OMOP common data model. This paper that was led by Alex and in Jason Su's lab is a nice illustration of why we need to be working harder to communicate about the content of our individual data sources and the operations that we require to standardize those data to the OMOP common data model. And this is the kind of thing we hope to see as a role model to serve for all of the data sources that are going to be part of our OHDSI evidence network. In June, we had our OHDSI Europe Symposium. It was really great to see so many folks from around the world come together, not just from Europe, but also globally. I think one of the things that was really exciting about the OHDSI Europe Symposium was to really see a pretty substantial shift beyond just data standardization, which is really where the European community had been for quite some time, to really seeing applications of the European data network, in particular with large-scale collaborations such as the Darwin EU effort to bring together data across many European countries to generate evidence to support regulatory decision-making. June, we also saw releases another Hades-wide release, as well as a release of Keeper, Results Model Manager, and Strategos. Again, hardening the open source packages that are available, not just for standardizing specific analytic use cases, but in the case of Keeper, trying to provide us a capacity for doing evaluation of our phenotypes through chart review. In the case of Strategos, having tools to actually orchestrate analyses across all of our packages. In the case of Results Model Manager, much like we have standardized a patient-level data model to the OMOP common data model, we've really started to see our community harden the approach of having a standardized results model that can facilitate aggregate summary statistics from all of our packages being brought together. And it's great to see the progress that we made towards that. June, we saw a bevy of publications come out. One that I like to highlight is really a great illustration of methods research in collaborations in our community, led by AIC. This paper in JAMIA, comparing penalization methods for linear models and large observational health data, highlighted the array of different regression approaches that we actively see used that have all been implemented in our open source tools, but to see a methodologic evaluation to compare these approaches has applications not only for the patient level prediction area that AIC and the team have been working on, but also with direct applications anytime we're trying to fit large scale models, much of which predicated on the Cyclops open source tools that Mark Suchard has been leading for our community. July, we actually spent the month really focused on the OHDSI Evidence Network. So one of those aspirations that we talked about at the start of the year was trying to make data more accessible. And Claire Blackadder has done a wonderful job of trying to drive our community towards creating a coordinated effort around the OHDSI Evidence Network by facilitating folks to be interested, providing support to facilitate participation, and creating a construct whereby organizations who have access to patient-level data, who standardize to the OMOP common data model and are interested in potentially participating in generating evidence can sign up, execute an open source analysis package that shares high-level aggregate metadata about their data source, and then the OHDSI Evidence Network serves as a way to be a matchmaker between those who have important research questions and those who have important data that could contribute to those important research questions. And Claire's done a wonderful job in driving this for our community. Up to now, we now have over 37 data sources across 18 data partner organizations who have actually joined the OHDSI Evidence Network officially and have contributed their aggregate summary statistics to facilitate this process, with over 50 data partners somewhere in our onboarding process. Now, this is a tremendous accomplishment that I'm really proud to see the community come together, but I'll also highlight this as a small fraction of the more than 540 data sources that we've inventoried that are using the OMOP Common Data Model. And so this is still an area where we need to continue to drive forward if we really are going to be an open community driving this work together. In July, to motivate part of the open the OHDSI Evidence Network, we highlighted that there was a publication that coincidentally just came out in the first week of July, published in JAMA Ophthalmology. It was a paper that studied the risk of NAION on patients prescribed semaglutide. And I highlighted this was a study that was published based on a single analysis in a single database, suggesting a very large increased risk. But their conclusions themselves said, as this was an observational study, future study is required to assess causality. And we used the OHDSI Evidence Network as a motivation to actually stimulate a global network study led by Cindy Kai to focus on actually addressing this question. And collectively, we used the open source tools within the OHDSI pipeline, including the Strategist package, as a workflow for us to be able to design an observational study to address the question of semaglutide NAION, the results of which were presented on an OHDSI community call only a couple weeks ago, and a paper is under review that shows how our network was able to provide much more reliable evidence to evaluate this particular clinical concern. So I think it's a nice demonstration of taking the idea of the evidence network and putting that into practice for reliable evidence that the world needs. In July, we saw many more open source tool releases. In addition to the OHDSI-wise version 1.15 release, we saw updates to Cohort Generator, Cohort Incidents, Data Quality Dashboard, the Deep Patient Level Prediction Package, Feature Extraction, and the OHDSI Shiny modules. Again, demonstrating the tremendous progress we're making as a community in open source development. In July, we saw a range of publications came out. One that I'd like to highlight is Henrik's paper published in BMC Medicine, Development and Validation of a Patient-Level Model to Predict Dementia Across a Network of Observational Databases. This is a really nice demonstration of the patient-level prediction framework that the OHDSI community has developed, put at play to be able to look across a range of different databases, and really to underscore the need for us to be able to develop models and externally validate them in order to feel like we've learned something that is generalizable in the prediction space. I encourage folks to take a look at that if they haven't already. In August, we had our second of our two planned OHDSI standardized vocabulary releases. This release, which is our current vocabulary, now stands at over 11.5 million concepts with almost 100 million ancestral relationships represented across 143 vocabularies in 43 domains. Again, a testament to our vocabulary team. We were able to successfully deliver this vocabulary release on time and in concordance with the vocabulary roadmap that was pre-specified and agreed based on the landscape assessment of the community's needs. It also was a nice demonstration of our community contributions that were made from the broader community for those that had specific needs to expand or improve the vocabulary. Those contributions that were made from the community were able to be incorporated into this vocabulary release. I think the maturation of our OHDSI vocabularies is something we can be proud of this year. I think Anna Ostropolitz and the team have done a really wonderful job of trying to mature our work in the vocabularies. And I think this is going to become only more important as we continue forward. So congratulations to the vocabulary team for this progress. In August, we saw yet again a more collection of open source tools released, including new versions of characterization, OHDSI Shiny modules, patient level prediction, results model manager, self-control case series, and the Shiny app builder. Highlighting particularly here as it related to our initial onset goals of thinking about dissemination, that here we are talking about not only tools for generating evidence in the characterization, estimation, and prediction space, but also tools for dissemination. Jenna and team have developed now mechanisms to enable interactive exploration of results from our results model, which is really at least one paradigm to think about going beyond the traditional static publication as a mechanism to disseminating evidence. And it's been great to see the progress that we've been able to make in 2024 in this space. In August, we saw a pretty large collection of publications come out. One that I'd like to highlight is actually one that we didn't actually take time to talk about during the year, but it was a paper that was led from our colleagues at Bayer. And this was a paper that was published in the Journal of Clinical Medicine entitled Early Clinical Experience of Finerenone in Patients with Chronic Kidney Disease and Type 2 Diabetes in Japan, a multi-cohort study from the Fountain platform. The reason why actually I'm highlighting this paper is because this is a nice example of a specific industry need. We talked about the economic engine, what's driving OHDSI. We do have a lot of industry partners who are looking towards using the OMOP Common Data Model and OHDSI tools, as well as the OHDSI Evidence Network, to be able to facilitate meeting their own needs, whether it be for regulatory or other evidentiary purposes. And in this specific example, we've got an illustration of how the OMOP Common Data Model was used to take disparate data sources in Japan, convert them to the OMOP Common Data Model to facilitate an analysis that was able to generate evidence that was supportive of buyers' specific needs for their marketed product. I think this is a nice illustration of the kind of tangible benefits that can come from participating in the OHDSI community. In September, we saw, again, a wide collection of open source tools released. This included cohort generator, empirical calibration, and the results model manager making their way into CRAN to expand their reach, as well as additional version improvements for cohort method, feature extraction, phenotype library, and Shiny app builder. In September, we had a collection of papers that came out. The one specifically to highlight here was a paper published in the Journal of the American College of Cardiology entitled Comparative Effectiveness of Second-Line Anti-Hyperglycemic Agents for Cardiovascular Outcomes, a multinational federated analysis of LEGEND Type 2 diabetes. And this was our primary estimation paper that has come out of our LEGEND Type 2 diabetes work group. This paper first authored by Rowan Cara under leadership by Mark Suchard, with a large number of collaborators within our community, really reinforcing the ability for us to generate evidence at scale to study the comparative safety and effectiveness of type 2 diabetes treatments. And this is an important paper in our community demonstrating the value of the LEGEND principles, but is only one of many that we expect to come out of our LEGEND type 2 diabetes effort. Come October, we had many more activities that were going on. Some to highlight, our OHDSI India Symposium took place, and it was really wonderful to see so many new faces come together to think about how to collaborate in a new region with our India chapter having just started up recently. Really bringing folks together and to see the spirit of collaboration was truly exciting. With the OHDSI India Symposium just starting up, it was also a time to celebrate the closure of the initial IHI Eden project with the Eden Symposium that took place, which was a great celebration of the work that's been done through the original IHI project, but also with a look forward with the newly created Eden Foundation, representing an opportunity to facilitate collaborations across Europe even broader. And at this meeting, we heard a lot about the impact of open community data standards and open source tools that have been taking place in Europe. to facilitate and foster collaborations with our colleagues at the EMA, as well as across industry stakeholder groups, which I think is a great demonstration of how a coordinated sub-network within our broader OHDSI Global Symposium can take shape and deliver demonstrable enhancements for our community. We also saw the OHDSI UK Symposium take place, and it was really great to see how many folks would come together from so many different organizations in the UK, really with a spirit towards trying to create a nationalized solution, and to see a lot of collaborative spirit in trying to drive forward. Of course, a big event for us was our OHDSI Global Symposium that took place in October of this year in New Brunswick, New Jersey. A couple of things that I'd like to highlight about the Global Symposium that stand out to me. We celebrated evidence dissemination through presenting some of the work of the Legend Type 2 Diabetes Project, not only highlighting the results from that prior paper in JACC, but also some of the other results that have already made direct impact for regulatory decision-making and promise to provide more grounded clinical support through subsequent publications and other dissemination efforts. At the Global Symposium, we also highlighted our partnership between OHDSI and JACC. You heard from Harlan Krumholtz and Yuen and Chan as editors of JACC about the needs for us to figure out more effective ways to disseminate evidence, and more importantly, efforts towards raising the bar about what reliable evidence really means. And so I'm really hope that those that heard these messages think about our partnership with JACC as really a call to action for us to stay focused on the goal of reliable evidence, which was that thing that we said was one of our things we were passionate about at the start of the year. At the Global Symposium, we also did a collaborative effort to try to focus on collaborating on evidence at scale. For those of you who were there, you received a study. That study represented evidence, and we demonstrated a new framework for how to interpret study results in a consistent manner, and encouraged you all to think about joining the journey of evidence dissemination by imploring you to please take this evidence and think about publishing it. On the one side, I think that I'd heard feedback that people learned from this exercise and felt more equipped to follow the OHDSI approaches to evidence generation and interpretation, and felt more capable in being part of the process. On the flip side, we gave out 500 pieces of paper representing 500 different studies and asked 500 people to publish 500 papers. And since 2 months ago, I don't think I've seen any of them done yet. So I hope that everybody's eagerly anticipating submitting these papers and just is waiting to tell Mark the exciting good news that the paper is ready for use. But I hope, probably more specifically, that at least somebody in that room actually took seriously the call to action that all of us need to be responsible for participating in the evidence dissemination process. All of us are capable, and it's something that we just need to scale our collaborative process of having more hands on deck to contribute to these types of efforts. OHDSI October also gave us the opportunity to celebrate our 2024 OHDSI Titans. It was great to see the community nominate so many worthy nominations. So big shout out and congratulations to Alexander, Vlad, Anna, Oleg, Ling Ying, Martin, Claire, Cindy, Jung Ho, Jack, Monsi, Elise, and Max for all of the work that you've done for our community, and to celebrate our community recognizing the contributions that have been made across the wide range of space that our OHDSI community resides within. Again, we continue to see tremendous progress in open source development with the releases of core diagnostics, feature extraction, OHDSI Shiny modules, phenotype library, pHeValuator, SQL Render, and Strategist version 1.0. Highlighting here, feature extraction, making it into CRAN, providing a resource that now a much broader community will take advantage of, and also highlighting Strategist version 1.0, reaching the point of maturity that we think this really does represent the primary way of study orchestration across our community, and to see it now used across many OHDSI Global Network studies and the continued refinement under the leadership of Anthony Senna has been a big accomplishment to highlight in 2024. Highlight one paper from October to make reference to this paper, Incidence of Post-Acute COVID-19 Symptoms Across Healthcare Systems in 7 Countries. This was a study that was published out of the Eden Consortium, the output of having participated in a study-a-thon activity, one of those things that we pioneered and try to facilitate collaboration, but also to see generalizable results across a wide range of different databases as an important accomplishment demonstrated through this publication. In November, we got to celebrate Dr. Erica Voss successfully defending her PhD. One of the things that I want to highlight about this, one is that I'm tremendously proud of Erica for her perseverance and driving to reach this important milestone. Erica actually started her PhD not soon after OHDSI had actually started, and this dissertation actually represents a completely centered work that came out of our OHDSI community throughout the journey from data to evidence. What I also like to highlight, and you can see it for those that can see the picture, is this really represented an OHDSI family event in that Erica there is supported by her paranymphs, including Ross Williams, who successfully defended his OHDSI-based PhD only last year, her promoter, Peter Reinbeck, and her committee that included OHDSI collaborators, including Nicole Pratt from Australia, Mark Suchard from UCLA, Katja, who's now co-coordinating the Darwin EU effort, Martijn, who was Erica's co-promoter, Ruud Salas, who is now leading our rehabilitation work group, and Gianluca, who was involved early on in our OHDSI community. So to see so many people from around the world coming together, both to challenge Erica, but also to celebrate with her this tremendous accomplishment, was certainly one of the highlights for me in 2024. November also saw us release Cyclops and SQL Render new versions. Both of these are available in CRAN, and we actually see under Mark and Martijn's leadership these two tools getting tremendous amounts of use in the broader research community. November saw a publication from our colleagues in the Darwin EU, standardized and reproducible phenotyping using distributed analytics and tools in pharmacoepidemiology and drug safety. Albert just presented about this last week on our community call, but I think this is an important paper for folks to take a look at to understand the processes that Darwin's following, but also to see how, as a community, we can continue to collaborate and evolve our processes for phenotype development and evaluation. And then just last week, we had our OHDSI APAC Symposium. I'm still recovering from the jet lag from arriving back from Singapore yesterday. It was a great opportunity to see folks from the Asia-Pacific region all coming together to talk about how we can mature as a community in data standards. This was also a great example of our community rallying together for a common cause. We had a research question that was raised by a regulator in Singapore that Evelyn Go, one of Morning's graduate students, was able to present the results during the symposium and showcase a study that was collaboratively designed with researchers from APAC, Europe, and North America coming together to conduct an analysis that ultimately ran across databases in the US, including claims in EHR and the VA, as well as data partners in APAC, in Korea and Taiwan, bringing evidence that was presented at Singapore to support this regulatory question. And that would probably have been the highlight if not for this, which hopefully will play.
There we go.
So that was our leader morning, who found an important way to figure out how to deal with a AV conflict, which was to showcase his dancing skills, adding to yet another memorable moment in one of many of our Odyssey symposias that happen around the world. Now, December is only 10 days in, but we've already seen a new release of Hades, as well as updates to Characterization, Shiny App Builder, and Strategus, demonstrating that the work's never done. And we've already seen publications coming out in December. Craig just highlighted one earlier today, but this paper on evolution of a graph model for the OMOP Common Data Model is a nice illustration of how folks from across our community are thinking about the next generation of activities and approaches that we can take towards analyzing data. So I want to highlight that in aggregate, where we are as a community, if one of our engines for economic growth is academic publications, then we're continuing to see tremendous acceleration. Together as a community, we've had over 750 publications. That includes work that's in top clinical journals as well as leading methodologic journals, and which kind of covers a wide range of clinical evidence. So I think that's something that we certainly can be proud of. And in terms of open source development, we saw a lot of tremendous contributions and support and development this year. Our Hades ecosystem now represents 37 packages, and we've seen downloads now exceeding 800,000 times across collectively the Odyssey tools and Darwin EU tools. And this is only going to be possible to continue to grow and expand through the generous contributions of those in the community. So I've left 10 minutes. 7 minutes. Sorry about that. I'm going to go back to our poll everywhere and put this on to see what you all think is the highlight of the year. And I see a lot of people are excited about the Odyssey Evidence Network, as well they should be. I see the Global Symposium was also a highlight. We see Hades and package organization, something that's highlighted. The Legend Type 2 Diabetes results. Folks enjoyed their time at Odyssey Game Night, which is always good. The semaglutide NaON study getting recognized. April Olympians. The Eden Mega Study, which once published will be our largest ever Odyssey Network study. Darwin, Phenotype February. Networking. Strategus being out. Country nodes. Tutorials and symposium. Very good. Well, I'm glad to see that there were highlights for many of you in the community. What I'd like to do now is I'm going to stop sharing here and invite anybody who's on the call who'd like to share their own thoughts and reflections on the year 2024 to please chime in with your own thoughts to share.
To say thank you, Patrick, for the amazing summary. And, you're thinking the symposium had almost 500 people, over 500 registrants, and almost all of them came. You think, wow, that's really growing large. But when you see everything that was accomplished in the last year, maybe 500 is small, and we're going to need to expand to 1,000 to accommodate all the work we've been doing for the last year. So thank you for the summary.
Peter?
Yeah, second that. I think we should all be extremely proud on what we are delivering here as a big community. So I just want to also thank everybody for making things possible that we are doing in Europe. I know we have a lot of push in Europe, and I'm sure we're going to continue doing that with all the effort that are ongoing and will happen in the future. But it's also because of the big Odyssey community that it is possible. So thank you for that. And I'm really looking forward to continue that and push more in Europe with all of you together.
Thank you, Peter. Patricia?
Hi, new user or new member this year from Health Partners, and just wanted to say what a wonderful organization this is. I had been begging our organization to join for a couple of years, and we finally did, and it's just been phenomenal. I think even far exceeded my expectations. The community is so welcoming. We've joined the Evidence Network, and we've joined three network studies. We've had pause on it because we can only handle so much right now. But I've also got an idea for a network study that we can lead, and we just really enjoy being here. Thank you so much.
Great. Well, thank you for joining the journey. Again?
I think it's a wonderful year. I want to thank the OHDSI community for all the leadership, mentorship, and resources. And that has been incredible for me when I was as a PhD student. I've learned how to do reliable real-world evidence and building methods for real-world evidence generation. But all the resources, this community has been even more incredible when I started to take an independent journey as a faculty, going to a new institution, knowing that I still have a community that I know very well, very nice people that I can collaborate with, and they bring different expertise from clinical, methodological, that it just, so rest assuring for me that knowing that I have a community that can always rely on, and there's always a place that I can ask for help to get honest and constructive feedback. So thank you so much for all the wonderful people that have helped me in the OHDSI community, and I look forward to working with you in the new year.
Thank you, Ling. Anyone else? Well, at the risk of potentially upsetting Andrew Williams, I'm going to do it anyway. I'll say that we should have a lot to be proud of, but we also should take stock of what we said we wanted to do at the start of the year and what we actually did. And at the start of the year, we were excited and passionate about, I won't pull up the slide again, but I'll just read it to you again. We were deeply passionate about reliable evidence, impact on patient care, and simplifying the process for making data available. And what we thought we would be the best of the world at was large-scale evidence and global network studies in developing and validating methods for real-world data to generate evidence. And so I think we all should be proud of what we've accomplished. And certainly I am proud of what our community has done. I'd still say that the job is not finished. We still have not generated all the reliable evidence we need. We still have not had the impact on patient care that we want to do. We still have not fully simplified the process for making data available. We still need to be able to generate evidence at scale at a much broader level. We only conducted a relatively modest number of global network studies this year. And we have made tremendous progress on developing and validating tools, but those tools will only be useful if our community adopts and makes use of them. And so while I want everybody to, as you're going into the holiday season, to be satisfied and proud of the work that you've all contributed to the community, I also want you to not be entirely satisfied that we're there yet. I think that we're on a long journey, as George highlighted in his letter and in our Journey book this year. 10 years is a lot of fun to look back at in terms of what you thought you were going to do versus what you are able to do. But if we're going to push ahead, we really need to be thinking about how we can be much more ambitious as a community, and how we can figure out even better ways to collaborate together. And so I'm really eager in 2025 to think about very concrete ways that we can all be collaborating more actively together to have an even larger impact for the patients that we aim to serve. But before we get to 2025, I hope you'll all join next week, and we'll have a little bit of fun one last time as a community, and we'll have our OHDSI holiday themed last community call of the year. Craig and I will still figure out something to do that will be fun, but I promise that it'll be unlike your normal day-to-day activities. And so I definitely encourage you to come next Tuesday to have one last time to celebrate as a global community on our weekly calls. So thank you all for joining. Thank you for a productive 2024, and look forward to many more collaborations to come.